From the Toronto Star, I'm Sabah Itazaz, and this matters. As provinces across Canada are entering final stages of reopening and relaxing restrictions, public health officials have a warning. This isn't over. Experts are saying a second wave of COVID-19 is inevitable, and Prime Minister Justin Trudeau has echoed that sentiment.
As that second wave begins, or as we start to see resurgences in a reopened economy, how quickly are we able to contain them and control them?
Experts at the University of Toronto say it could be devastating for an economy already reeling under deficits and helping Canadians and Canadian businesses struggling under the weight of a deadly virus. It might all come down to the lessons that we learn now and apply later. Fall usually means flu season. This time, it could also be COVID season. So what might a second wave look like? Are we prepared? And what does this mean for the economy? Dr. Stephen Hoffman is the director of the Global Strategy Lab and a professor of global health, law, and political science at York University, and he joins me today to answer some of these questions. Thank you so much, Stephen, for joining me today on the podcast.
Thanks for having me.
So I want to ask you, how likely is a second wave of COVID? When could it happen? What are the circumstances that could build up to that? And what would that look like?
Well, there's nothing preordained about getting a second wave. So if we maintain physical distancing and all of these layers of protection that we've put in place over the past months, we could maintain low levels of transmission such that we'll never get a second wave. That being said, what's more likely to happen is, as we're watching and learning from other countries, it's likely that all the things that come with fall, whether it's the cold weather, the fact that we're indoors more often, closer together in groups, means that it is likely we will have a second wave in the fall. And what that means is that it makes sense to be ready for it. What it ultimately looks like will depend on how each jurisdiction responds to it. So in the Canadian context, what we get will very much depend on the kind of actions that all of us take, but also will depend on what kind of measures we're ready to do in response to the second wave once it is likely to come upon us. And in some respect, it'll be very similar to what we had in March and April, when this outbreak was first accelerating within Canada. The big difference, though, with the second wave is that we have the benefit of lessons learned from wave one. And so that will be key, that we make sure to use all those lessons so that we have an optimal response.
As you know, with fall and cold weather, a lot of the factors that you mentioned, and then there's other viruses that we've seen kind of pick up during that season. And now kids are also going back to school, etc. So it could seem like we might be heading towards a second wave. And if we are, would we have to roll back some of the measures and some of the loosening of rules that we've seen in place?
Well, I think it's certainly very likely that we will see a second wave in the fall for all the reasons previously mentioned. And yes, I think the one thing that I worry about is what happens when we do get to that point where a second wave is affecting all of us and we have to ask citizens again to go back into doing those more extreme physical distancing measures. Closing schools again, for example, working from home, closing down certain non-essential businesses. I mean, this experience in March, April, May, June, this was very difficult for all Canadians. And so to ask Canadians to go back to that if our cases get bad will be difficult. And my hope, though, is that thinking about that will encourage everybody to take protective measures now so that we're minimizing transmission to likely avoid or at least mitigate a second wave as much as we can.
And as you mentioned, this experience has been difficult enough as it is. I want to bring our focus to the economic impact of all this. For the current situation, what do you think has been the economic impact? We're looking at a 300 billion plus deficit. That's not including provincial and local deficits. So that's got to come with implications, right? And will this kind of economic pressure play into how we respond to a potential second wave on a government and individual level?
Well, that's right. So I think pandemics affect people in so many different ways. The first, of course, is that the virus causes biological consequences within anyone who gets infected. But even more so, this pandemic might be actually causing its harm via all the different ways in which we've had to react to the virus and protect ourselves from it. I mean, there's a lot of people who've lost their jobs. There's a lot of people who have suddenly found themselves in precarious situation when it comes to food security or housing. This pandemic has not been a fair pandemic in that it's affected those who are already the least well off. And so in our society in Canada, we live in one of the richest countries in the world, one of the best prepared for a pandemic. Even in our country, we've seen the disproportionate and rather significant consequences falling on a sizable portion of our population. And so when thinking about sort of those economic consequences, that's often the way this pandemic has hit most Canadians. Indeed, it's only about 1% of Canadians that might have been exposed to this virus up until now. But yet, all of us have experienced this virus in one way or another. And often it's through those economic measures. What that means, though, is as we do get into this thought about a possible second wave or a third wave or a fourth wave that could come possibly afterwards, hopefully not, we need to be ready for making sure that our economic response is tailored, especially for those who are the least well off and who are most likely to be affected by the pandemic. And the good news is that we have lessons learned from the first wave, which can inform a better targeting of those efforts if there is a second wave.
I think you very aptly mentioned that this pandemic has not been a fair pandemic, and we've seen the virus expose certain inequities and inequalities quite starkly. And we know that certain racialized and marginalized groups have been more vulnerable to it and suffered more from the impact. So would the economic impact of a second wave once again hit those people the hardest? And you mentioned lessons that we can take from right now. So what are those lessons that can help us to avoid that and protect them if we start thinking about this now?
Well, I fear that a second wave or third wave will again disproportionately burden those who are already least well off. It's the nature of emergencies and crises, and it's unfair. And it's also something that's completely avoidable if we have the right social protections and systems in place. So in this case, what we saw is that those who have certain kinds of jobs that where you have to be going to work in person, those were the first kinds of jobs where staff suddenly found themselves without contracts or without jobs. Or certain industries are much more likely to be contractualized without permanent employment, which then makes it, again, more difficult and fewer protections. I think one of the silver linings from this pandemic could end up being the changes that can be motivated by what we've seen and have seen to be unhelpful and that for which we're not satisfied with during this pandemic. For example, going into this pandemic, there's so many Canadians who did not have access to sick days. It's a basic thing that when people are sick, we really don't want them to go into work. And those people, it's really just untenable for folks to be in a position where they have to choose between either going to work and putting food on their table for their kids or protecting their coworkers by staying home, but then not having food on their table for their kids. That's just an unfair, untenable choice that people are put in. But it highlights that our system didn't fully account for the many, many Canadians who don't have sick days and can't choose to do it. That makes all of us sicker because when people have those choices, they of course have to make those choices, and then all of us are worse off as a result.
Right. And this is exactly what I wanted to lead into asking you about the importance of that. You're talking about a lot of people with certain kinds of jobs who were essentially frontline workers during this crisis. Some of these people are the reason we could get our groceries, right?
That's right. I think that in this outbreak, we have seen that some of the jobs that do get paid less or don't have the same kind of protections of employment have indeed been on the front line of the social response to this outbreak. Because how could we be getting our groceries if we didn't have people who were there to make that possible, or the various folks who are cleaning hospitals and other health facilities, those who are ensuring our government services are provided? I mean, these folks are heroes in this pandemic. And so it does mean that we have to make sure to be recognizing heroes and protecting them accordingly. Sometimes that protection will be in the form of medical protective equipment, whether it's plexiguard protection or appropriate face masks. But in other points, it's going to be through providing social protection, meaning that if people who are on the front lines, ensuring we can get groceries, ensuring that if they, for example, get sick, that they're protected too, and they're provided for, and that we're all in this together. I think this outbreak has really been a grand revealer. I would say that going into the outbreak, I think everyone knew that there were inequalities in our society. But I think what this pandemic does is it's shone a light on how deep they are, how bad and how unacceptable they are. And in this case, inequality not only kills those who are least well off, but actually kills everyone, because it leads to behaviors and actions that don't advance the collective good, which is really what is needed to mount the most effective response to a pandemic.
We'll be right back. What kind of things should we be thinking about at this point in order to equip ourselves for the potential of this second wave? Do you think we've been too quick to perhaps reopen businesses that require close proximity, such as indoor bars or theaters, etc.? Although I do understand that there's a lot of pressure to reopen these sectors for the sake of the economy, right?
For sure. I think what we have to realize is that a response to a pandemic requires putting in place layers of protection. And as the outbreak has lessened in Canada, we've been able to slowly and strategically lift certain layers of protection while still retaining other layers of protection. That's the key. If we lift too many layers of protection too fast, we find ourselves in a bad situation. If we're smart about it, we can ideally delay, if not even prevent, future waves of this outbreak from coming. But in the likely situation that we do face a second wave, for example, in the fall, we need to be ready, both mentally, socially, but also infrastructurally, to reapply some of those layers of protection that we have since lifted. Now, that's not going to be easy. I know that everyone is just done with this pandemic, ready to go back to normal. I certainly am. But the reality is that we're very likely to find ourselves in a position in a couple of months or a few months from now where some of the newfound freedoms that we're enjoying again are things we're going to have to ask of citizens to refrain from doing. And the depth of the second wave, or how light it is, will very much depend on how citizens respond to that call for action. And the hope is that people aren't so exhausted from all the efforts in wave one that we can't mount an effective response in wave two, because that would be very bad.
Right. And I do want to come to that as well, about the psychological toll of all of this and how that could also affect the economy and a potential second wave. But if this should come about, could this mean a second round of economic shutdowns? I know there's some conversation within expert circles talking about that might not be necessary or sufficient, and sometimes interventions such as reintroducing just, social and recreational precautionary measures would be enough. But do you see a second round of shutdowns as we've seen currently?
Well, we're in new territory. We've never seen a pandemic like this one while having the science and knowledge to be able to track and actually mount an effective response to it. I think what's really important to answer that question is we have to remember that this is literally the first time that humans are trying to beat back a pandemic without allowing it to progress to its natural end. We're trying to stop it from continuing. Now, of course, the key there is science, and we're looking for a vaccine and for therapeutics and for the effectiveness of various measures. But it's also that science that brings to the fore how bad this pandemic is, right? So it was within days of its genetic sequencing, we had a diagnostic test for this virus back in January. Never in a pandemic have we had tools like that so early. But what that means is that we're actually seeing this outbreak, and then as a result, we're trying to respond to it, mobilizing a response like we've never done before. I think that as we've learned from other jurisdictions who've also been responding to this pandemic, we're seeing that a lot of voluntary efforts mobilizing the public can work and can achieve quite significant results. The key, though, is to maintain public trust and engage communities as part of the process. But sometimes that's still not enough. And indeed, in March and April, it got to a place where there needed to be more significant lockdowns in most jurisdictions of the world. We could very well find ourselves back in that situation, but we've also learned a lot since then. So ideally, we'll be able to actually mount some more targeted, nuanced response in the fall if we do find ourselves with a second wave to avoid the worst of the lockdowns. But that being said, we also need to be ready for it if things do get bad.
Right. And if you push COVID to the side, we've got huge debt overhangs at the government level globally. We have deglobalization underway. And some of us who are just basic consumers might be afraid of tapping our savings or spending or of all the uncertainty that's coming. What does that mean going forward?
Well, I'm not an economist, but certainly I find myself thinking about these questions as well as a citizen and as someone who studies pandemics for a living and has long noted the kind of widespread implications that a pandemic like this one would have. I think what it highlights is that our systems are not as resilient as they need to be to emergencies. So in this case, this pandemic, it's not even the worst case scenario that we weren't expecting that a pandemic might come. I remember a couple of years ago when we were, quote, celebrating the 100-year anniversary of the Spanish influenza, noting that it had been over 100 years since the last big pandemic of this kind, and noting that even if we think of it as a once in a 100-year event, we're due. And certainly what we have gotten has been terrible for so many of us, if not all of us. But what it highlights, though, is that we're actually really not ready for even worse pandemics that might come and are more likely to come in a globalized world where there's such interaction between people and it literally takes 17 hours to fly to the other side of the planet. I think what that means, though, is we need to build social protections, we need to build structures, we need to build systems that are actually ready to respond to these kind of emergencies and help all of us get through it in a good way.
We've talked about this before, and I want to speak a little bit more to it in terms of the uncertainty and the fear. How much of that plays a factor into this if we see an oncoming second wave? How would that take a toll on people's psychology and then affect how we live our lives and how overall the economic picture of Canada is?
Well, I think pandemics are scary. Certainly, we've now seen how much a pandemic can affect some of the things that we have long taken for granted in our lives, like the ability to go out to a store and buy toilet paper. I remember in February when there was a run on that product, suddenly some of our expectations were no longer all being met. And I think what that highlights is that we need to be there for each other during these scary times. I think that the good news is that we've now all gone through this collective experience. We better understand what it looks like, what's likely to come. And ideally, having that knowledge should make all of us more resilient to its consequences if they do follow. I think that what was particularly scary about this outbreak in the winter and spring was that we just didn't know so much about it. And indeed, we still don't know so much, and we're still learning more every day. But we got a sense of what it looks like. We got a sense of what lockdowns feel like. We got a sense of what kind of protections need to be in place, what kind of backup plans there are. And so as a result, while all of them are not perfect and we have much to improve upon, at least we're not walking into the same kind of unknown. And as a result, hopefully that can give people some measure of comfort, or if not, give some additional advance notice to plan for that accordingly.
So we're still also learning along the way. What, in your opinion, could be the worst case scenario in the face of a second wave?
Well, the worst case scenario is just that this virus continues to spread and continues along its natural course. I think that what we're really trying to do here is something we've never achieved before, which is we're trying as humans to beat back a pandemic from going its full natural course. Will we succeed? I think we will. So I'm actually optimistic. I think that if you consider how much we've learned about this pandemic and this virus in such a short period of time, it's extraordinary. I mean, I think that the real hero of this pandemic, in addition, of course, to our frontline public health workers and those who are enabling our lives to continue, those working grocery stores, cleaners, government workers, that we can think of science actually as a hero in that it was just days to get a diagnostic test. It took just hours for the genomic analysis of this virus to be shared globally with scientists around the world. We now know so much more about masks than we knew at the beginning of this outbreak. We're learning about how this virus transmits. We're starting to see some promising trials of vaccines. This is very positive and something we've never seen before this early in a pandemic. So the worst case scenario is that it continues along the course like every previous pandemic has occurred. The good news, though, is that with the power of science and investments that countries like Canada have historically made in science, it means we actually have a very good chance of doing something different this time, doing something much better.
That's a very optimistic outlook, and we hope that happens. If you're talking about a second wave, and if you're talking about if it forces closures, how could that look different in terms of Canadians looking to the government for assistance? Would we see something different in terms of that instead of the more generous support we've been seeing so far? Would it be more of a challenge to come up with assistance programs when we're already dealing with deficits? And could this diminish the impact of measures like CERB and wage subsidy programs?
Well, certainly when this pandemic first occurred, I remember thinking how fortunate I felt to be living in Canada, where not only do we have a fantastic system for public health, but we also had greater fiscal firepower to respond to it as needed. And certainly our federal government and provincial governments have made use of that fiscal firepower in extraordinary ways, more so than I really ever imagined would be used. And time will tell whether each exact program was perfect, how it could be improved. There is no perfect response to a pandemic, so the key is that we learn as much as we can from each one. But I think what it highlights is that there are limits to support, but that because we live in Canada and because we have the great fortune of having fiscal space, we have seen a more robust response. What are the limits of that response? I certainly do not know, but at least everything we're hearing out of our governments is that they do still have quite a few tools left in their toolbox in case they're needed.
Stephen, what are the key lessons or key observations that resound the most strongly with you about what can help us through the second wave or even future pandemics?
Well, I think that the key insight for me is that we get to decide how prepared we are going to be for a pandemic. And the time that we decide is not once the pandemic has started. It's every time a government issues a budget and decides how much to invest in public health infrastructure. I think when you look around the world, those countries that have had the most robust public health infrastructure are the countries that have been able to respond the best, with the exception maybe of our neighbors to the south. And so what that really highlights is that if we want to be able to be prepared for and respond effectively to these kind of emergencies, we need to make those investments upfront. And we need to remember pandemics like this several years after they're complete. Because, of course, immediately after a pandemic, every government's going to increase investment in pandemic preparation and response capacity. But are they going to sustain that investment a few years later? That's the key question. And it's something that all of us will need to be thinking about. I think the other key insight is the power of science. We have never before seen science act so quickly. For example, in the Canadian context, the Canadian Institutes of Health Research mounted the world's fastest rapid research response of any government out there. It was literally within a couple of weeks, scientists received a call for proposals to ensure that they could be on the front lines of a scientific response to this novel virus. That is so essential, and it's those kind of successes that we need to build upon because we need to make sure we're ready for the next emergency and pandemic when it inevitably comes.
You've been so insightful, Stephen. Thank you so much for your time.
Thanks for having me.
That was Dr. Stephen Hoffman, Director of the Global Strategy Lab and Professor of Global Health, Law and Political Science at York University. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mudhir. Produced and mixed by Sean Pattenden, and our Director of Programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.